Good morning, everyone. Welcome to the first episode of VishwaRaj Health Insights, where we will be talking about COVID-19 and pregnancy. Here, we will be answering all your pregnancy related queries during these COVID times. तो इसके लिए आज हमारे साथ जुड़ी हैं डॉक्टर योगिनी पाटिल, कंसल्टेंट ऑब्स्टेट्रिक्स एंड गायनेकोलॉजी, विश्वराज हॉस्पिटल. Thank you, doctor, for joining with us.
Hello, Mukta. Thank you. And a very good morning to all my viewers.
So, doctor, as we are living in these COVID times, the expecting mothers have many queries in their minds. So, what precautions should an expecting mother take during pregnancy?
I think COVID-19 and pregnancy is a very, very important topic to be discussed here today. सबकी माइंड में डर है, शंकाएं हैं प्रेगनेंसी के बारे में, और इसीलिए हमने ये टॉपिक आज चूज किया है. Pregnancy is actually such a happy and exciting time for the mother and the whole family. But nowadays everybody is scared. They don't even go to the hospitals for regular checkups because of this pandemic. So I think, I can share some few tips and some precautions which you can surely take during this pandemic and if you are pregnant. फर्स्ट एंड फॉरमोस्ट थिंग जो आपके पास एक बहुत ही बड़ा वेपन है आपके साथ है वैक्सीनेशन. आई थिंक वैक्सीनेशन प्रेग्नेंट वुमन में सबसे कम परसेंटेज में हुआ है, क्योंकि सबको ऐसा लगता है कि प्रेगनेंसी में वैक्सीनेशन सेफ नहीं है, उनके लिए सेफ नहीं है, उनके बेबी के लिए सेफ नहीं है, लेकिन ये गलत है. आज तक there has been no proof anywhere in the world that vaccinating the pregnant woman has caused any harm to the mother or to the baby. इसलिए गवर्नमेंट ने भी अब अप्रूव किया है कि all pregnant women or preconceptional women even who are trying to get pregnant should get vaccinated, complete their vaccination schedule, and अब जब बूस्टर का टाइम आएगा तो उनको बूस्टर भी लेना है. आप कोविशील्ड ले सकते हो, कोवैक्सीन ले सकते हो, जो भी वैक्सीन अवेलेबल है वो ले, उसका पूरा शेड्यूल आप कंप्लीट करें. एंड आई थिंक दैट इज द बेस्ट प्रिकॉशन विच यू कैन हैव इन दीज टाइम्स व्हेन यू आर प्रेग्नेंट. सेकेंड इम्पॉर्टेंट थिंग इज, जैसे हम पूरे जनरल पॉपुलेशन को बताते रहते हैं कि आप मास्क पहने, क्राउडेड प्लेसेस अवॉइड करें, विच इज आई थिंक वेरी वेरी इंपॉर्टेंट फॉर प्रेग्नेंट वुमेन, कि आप क्राउडेड प्लेसेस में बिल्कुल न जाएं, सोशल डिस्टेंसिंग मेंटेन करें, मास्क पहने और उसे प्रॉपरली पहने. मतलब आप उसको पूरा आपका नाक, आपका मुंह, आपका चिन तक कवर होना चाहिए. तो आप प्रॉपरली हर बार जब बाहर निकले तो मास्क पहने. उसके बाद आप आपकी जनरल हेल्थ बनाए रखें. Eat properly, exercise daily, and maintain your general health. Especially for pregnant women, I would say that they should not miss their antenatal appointments. हम देखते हैं कि प्रेग्नेंट वुमेन कोविड के डर से हॉस्पिटल आना बंद कर देती हैं. आप उनकी जो फोर्टनाइटली हो, वीकली हो या मंथली उनकी जो एंटीनेटल विजिट्स हैं वो सारी मिस कर देती हैं, जिसकी वजह से the doctor is also clueless what is going on with a pregnant woman, and pregnant women miss out on so many of the tests, investigations, sonographies, and I think this is the most problematic thing which is going on. हम देखते हैं कि हमारी OPD कोविड टाइम्स में बिल्कुल कम हो जाती है, which is actually a not good thing. So आपका जो भी शेड्यूल है, आपके डॉक्टर ने आपको जो भी शेड्यूल बताया है आपका एंटीनेटल विजिट्स का, तो आप वो फॉलो करें. आपके डॉक्टर को आप जब भी डॉक्टर बुलाते हैं तब मिले एंड सारी आपकी टेस्ट करते रहें. And I think this is also a very important precaution which you can take, which when you are pregnant and when you are expecting and during these COVID times. Last but not the least, आपको कोई भी सिम्टम होता है, कोई भी हो, फीवर हो ना हो, लेकिन अगर बॉडी एक हो, सर्दी, खांसी, सोर थ्रोट हो, जो भी छोटा मोटा आपको कुछ भी सिम्टम हो, आप तुरंत हॉस्पिटल में पहुंचे और आपके डॉक्टर से मिलिए. प्लीज मीट योर डॉक्टर इमीडिएटली ऑन गेटिंग एनी सिम्टम. because of this scare of going to the hospital, women just, or even the general public just, takes medicines over the counter. किसी friend को या relative को पूछ के कुछ medicine ले लेते हैं and 3-4 days तक hospital नहीं पहुंचते हैं. जब तक पहुंचते हैं तब तक शायद severity बढ़ जाती है symptoms की. So please don't do this, and especially when you're pregnant, you please reach the hospital and meet your doctor as soon as possible. I think these are the very doable precautions which you can take when you're pregnant.
Great, doctor. So are pregnant women really more vulnerable for COVID?
Okay, now in this regard, I would say that सिर्फ pregnant होने से आपको ज़्यादा जल्दी कोविड नहीं होता है. दिस इज अगेन मिसकंसेप्शन कि आप प्रेग्नेंट हो तो आपको बस ऐसे ही कोविड हो जाएगा. ऐसा नहीं है. जितना खतरा, जितना रिस्क जनरल पब्लिक पॉपुलेशन को है, उतना ही प्रेग्नेंट वुमन को है. But yes, this is the most important thing, that pregnant women, if they get exposed and if they get COVID positive, उनको complications बहुत जल्दी हो जाते हैं because of their pregnant state. And उनकी severity of disease बिल्कुल ज़्यादा होती है general population से. इसलिए it is more important कि pregnant women should avoid any contact, and they should take utmost care of themselves during COVID. Another thing is that when a pregnant woman gets COVID, the doctors have to deliver her prematurely. क्योंकि जब तक बेबी अंदर है, आपको पूरी तरह से ट्रीट नहीं कर सकते हैं, सारे मेडिसिन नहीं दे सकते हैं, एंड आपकी रिकवरी प्रोसेस स्लो हो जाती है, एंड आपके कॉम्प्लिकेशंस भी बढ़ते रहते हैं. इसलिए द डॉक्टर समटाइम्स हैज टू टेक अ डिसीजन ऑफ डिलीवरिंग यू एज सून एज पॉसिबल. एंड ये आपको हमेशा दिमाग में रखना है कि अगर आपको कोविड हो गया प्रेगनेंसी में, तो आपको शायद प्रीमैच्योर डिलीवर करना पड़ सकता है. एंड दैट इज ऑल दीज रीजंस आर why we say that pregnant women are more vulnerable during COVID.
So doctor, if an expecting mother becomes COVID positive, so does COVID affect the baby also?
Yes, this is again a very important question. There have been so many tests which are done on pregnant mothers who are COVID positive to see if their babies get COVID intrauterine or during delivery. But fortunately ऐसी कोई भी proof हमें आज तक नहीं मिली है जिससे पता चले कि intrauterine बेबी को कोविड हो सकता है. जो बेबी के आजू बाजू का जो एमनियोटिक फ्लूइड होता है ना, उसमें लाइव कोविड वायरस पाए गए हैं. सो इसलिए इंट्रायूट्राइन ट्रांसफर इज नॉट पॉसिबल. सो प्लीज बी एश्योर्ड दैट अगर आपको कोविड हो जाता है प्रेगनेंसी में, तो आपका बच्चा सेफ है until the mother is safe and not in critical condition. Also, when you go to the hospital to deliver, if your delivery is conducted in a good hospital with good facilities, taking into care all the universal precautions during delivery, तो डिलीवरी के वक्त भी आपके बच्चे को कोविड होने के चांसेस बहुत कम हैं. As soon as the baby is delivered, the baby is handed over to the pediatrician and the baby is isolated from the mother, and tests are conducted on the baby, and most probably the baby is COVID negative. So आप बिल्कुल न डरे कि आपको अगर प्रेगनेंसी में कोविड हो जाता है तो आपका बच्चा, if all precautions are taken, will not be infected with COVID.
Another question on being COVID positive: can I breastfeed if I'm COVID positive?
I think this is again a very very important question, क्योंकि सबके दिमाग में इतने ज़्यादा questions हैं breastfeeding के बारे में. See, breastfeeding, breast milk is the best defense that your baby can have when it is born. Okay, so I'm telling you this to you, and you should all remember this, that a breast milk may, again, there have been no live viruses found, and breast milk is 100% safe for your baby even if you are COVID positive. Of course, there are some precautions which you can take if you are positive. अगर मदर को बहुत ही माइल्ड सिम्टम्स है या फिर वो असिम्टोमेटिक है लेकिन इंसिडेंटली उसका कोविड PCR टेस्ट पॉजिटिव आया है, बट शी इज डूइंग वेल, शी कैन डायरेक्टली ब्रेस्ट फीड हर बेबी. She has to of course maintain hand hygiene and respiratory hygiene, जिसका मतलब है उसे अपनी बेबी को अपने पास लेने के पहले आपके हाथ धोने हैं, फिर आपको मास्क पहनना है जो आपके बेबी को प्रोटेक्ट करे, एंड देन ऑफ कोर्स यू कैन ब्रेस्ट फीड योर बेबी डायरेक्टली. What you can do is immediately after breastfeeding the baby, you can give the baby to the caretaker, and then the baby can be isolated, and next time when it is time to feed the baby, you can again repeat this process. Another scenario is that if the mother is not well, अगर मदर सिक है, कुछ उनको कुछ कॉम्प्लिकेशंस हो गए हैं, या फिर शी इज नॉट इन बेस्ट ऑफ हर हेल्थ एंड शी इज नॉट एबल टू फीड द बेबी डायरेक्टली, देन अगेन एक्सप्रेस ब्रेस्ट मिल्क कैन बी गिवन टू द बेबी. जो केयरटेकर है, जो हेल्पर है, दैट पर्सन कैन टेक ऑल द यूनिवर्सल प्रिकॉशंस, कैन वॉश हर हैंड्स प्रॉपर्ली, यूज मास्क, express the breast milk, and that breast milk can be fed to the baby without any doubt in the mind. So breast milk again is best for the baby. You are COVID positive or not positive, please don't discontinue feeding the baby and keep giving the baby the best elixir of life which it can have.
Doctor, please throw some light on a query we have got. Should I take vitamin supplements to prevent COVID?
Okay. Vitamin supplements per se are of course good for you. They will maintain your general health. Doctors do prescribe vitamins, many kinds of vitamins, to pregnant mother also, and to other all other general population also. There is no harm in taking vitamins. But then again, I really insist that you should keep up your vitamin and mineral store by getting all the natural vitamins and minerals available in your food. So I think healthy diet and healthy food, again, which is recommended by your doctor, is also very important. And of course, you can continue taking whatever vitamin supplements have been prescribed to you by your doctor.
Doctor, what should be kept in mind while choosing a hospital for delivery in these COVID times?
Okay, now again, this is a very good question. I really think COVID or non-COVID, you should always choose a hospital which is best for you in terms of care and safety, and also which will take good care of you if you land up in any complications. Now, having said that, your hospital should be well equipped to deliver you properly, take care of the baby. If the baby needs an ICU, that hospital should have an ICU set up to take care of your baby. If you land up in any complications, COVID or non-COVID, any patient during delivery, during C-section can land up in complications, and that hospital should be entirely equipped to deal with this. Okay. Now, in these COVID times, everybody has this misconception that जिस हॉस्पिटल में कोविड के पेशेंट डिलीवर होते हैं, वहाँ पे नॉन कोविड पेशेंट्स की डिलीवरी नहीं हो सकती है, या वहाँ पे नॉन कोविड पेशेंट्स डिलीवर करना बहुत खतरे का काम है, मदर को हो जाएगा कोविड, बच्चे को हो जाएगा, या फिर रिलेटिव्स जो केयरटेकर्स आते हैं मदर के साथ, उनको हो जाएगा. बट लेट मी टेल यू, दिस इज एंटायरली नॉट ट्रू. Okay, any hospital which deals with COVID patients has its COVID facility entirely separate from the non-COVID ward. The labor room is separate, the OT is separate, the staff is separate, even the entry and exit to such facilities are separate. So don't choose a hospital thinking that this is a hospital where they only take non-COVID patients. Unfortunately, you in your pregnancy can sometimes get COVID infected, isn't it? And then your hospital, you should trust your hospital to take you for delivery and for all other post-delivery complications if you land up in any. That your hospital should not leave you just in between and say that no, now that you are COVID positive and you have to go to some other hospital. So I really think that choosing a hospital for delivery entirely depends on the facilities which it has, and not on that whether they are catering to only the non-COVID patients or only to COVID patients. Okay, so please keep this in mind, that choose a good hospital. That is what I would say.
Doctor, please also guide on how to be prepared for delivery in these COVID times.
Okay, now I think this is the whole summary of today's topic. Like I said, preparation of course starts from you. Okay, you have to be in best of your health. Follow all the precautions given by your doctor. Please carry on all your investigations and do not miss your appointments. This is the first thing. Next thing is complete your vaccination schedule. So many patients come to me and said that डॉक्टर हमने एक वैक्सीन ले लिया था उसके बाद I was detected to be pregnant and then I didn't complete my schedule. So please don't do it. In your preparedness for your delivery, please complete your vaccination schedule. Third and important thing is that, like I said, please avoid any contact with any COVID suspected patient. Don't go out, use mask and stay healthy. Then next thing is that choose the hospital which you are going to deliver yourself in, and please stick to the hospital and carry on your regular antenatal checkups there. And again, the important thing which I told you, that you have to be prepared that if you get COVID positive, you may have to be delivered prematurely. So I really think just collect all your things and keep all your files ready, keep all your maternity bag ready. And if unfortunately you get COVID positive, get any symptom even, be prepared to reach the hospital. But then again, don't be scared. The hospital will take care of everything, even if you become positive or if your baby is delivered prematurely.
Hope this has cleared many doubts of the expecting mothers related to the pregnancy. I would like to thank Dr. Yogini Patil for sharing her valuable insights on COVID-19 and pregnancy. Thank you, ma'am.
Yeah, thank you so much. And I really hope that all of you pregnant or who are preconceptionally in that phase and who are gearing up to get pregnant, you have a very healthy and safe pregnancy, safe delivery, and a non-COVID uneventful pregnancy. Thank you so much.